Good morning, everybody. We are thrilled to have with us today a distinguished expert in the realm of functional nutrition, Tara Torres. Is it Tara or Tara?
Tara.
Tara. Okay. As the visionary behind Sky Therapeutics, Tara has been a beacon of knowledge and guidance for countless individuals, helping them navigate challenges ranging from metabolic syndrome to gastrointestinal disorders. Her journey, sparked by a personal diagnosis of celiac disease, has led her to become not just a functional nutritionist, but also a researcher, educator, and advocate for holistic health. Today, she's here to share her insights on adrenal health and women's hormones, a genetic dance. Without further ado, let's give a warm welcome to Tara Torres.
Thank you. Thank you so much for that introduction. I was going to try to remove that from my slide, but I'm going to go ahead and share my slide here in just a minute. My name is Tara Torres. I'm the owner of Sky Therapeutics, and I am a clinical nutritionist. So at Sky Therapeutics, we basically practice functional medicine, nutrition interventions. And I did go to school for clinical nutrition and functional medicine. I'm currently getting my doctorate in clinical nutrition from the University of Western States. So I just enjoy diving into the research and doing presentations like this. So when Chad and his team asked me to come and talk about this, I was not only intrigued, but I'm just super passionate about adrenal health and women's hormones in particular, and just understanding the connection between the two and how we live in such a fast-paced environment these days with so many people juggling things from career and like 90-hour work weeks sometimes to even stay-at-home parents juggling multiple kids and just multiple obligations. Like stress is just so prevalent in the current environment that we live in. And then stress can come from so many different forms between, infections, environmental toxins and exposures, perceived and physical stress, those types of things. So it's pretty wild how expansive it can be. And I don't think it's well understood the impact it can have on not just our adrenal health and our hormones, but our overall well-being. So, this is a little bit about me, but today I'm planning to go over our adrenal health. So we'll start with a brief introduction about our adrenals. And then I want to talk about the different phases of HPA axis dysregulation. And then we'll dive into, each of these hormones. So I want to talk about DHEA. I want to talk about the role of aromatization, testosterone, progesterone, and estrogen metabolism. And of course, the genetic influence on all of these before, a conclusion at the end. But honestly, each of these hormones, you could probably do an hour-long presentation on their functions and their role and how to inhibit them or enhance them, modulate them through food and herbs, lifestyle changes. So forgive me if I don't go all the way in depth on one of these, but I'm happy to answer questions at the end where I can. So first, let's talk about the adrenals. The adrenals, or your adrenal glands, are a pair of small triangular shaped glands located on the top of each of your kidneys. And they play a crucial role in the endocrine system, which is responsible for regulating things like, hormones and other bodily functions. So we have the adrenal cortex and the adrenal medulla. The outer part is the adrenal cortex, and it produces several hormones, including cortisol, aldosterone, and a small amount of sex hormones like estrogen and testosterone. The amount of sex hormones produced in the adrenals doesn't compare to like the testes in men and ovaries in female. However, DHEA is produced here, and it's a precursor to both estrogen and testosterone and the synthesization of sex hormones. So in women, especially after menopause, the adrenal cortex becomes a much more significant source of androgen hormones like DHEA. And then cortisol is known as our stress hormone and helps regulate metabolism, immune response, and our body's response to stress. And aldosterone is involved in regulating blood pressure and electrolyte imbalances. And then in the center of our adrenals, we have the adrenal medulla. And this is just that inner part. It primarily produces two hormones, which are epinephrine or adrenaline, and norepinephrine or noradrenaline. And these hormones are responsible for your fight or flight response to stress. So they increase your heart rate, dilate your airways, and basically prepare your body for a quick, vigorous response to danger or stress. And then we have what's called the HPA axis and different phases of dysregulation. So Our adrenals are responsible for maintaining homeostasis in the body, and the hormones will impact our metabolism, blood pressure, our immune function, and of course, stress. So any dysfunction to the adrenal glands can lead to different effects. So sometimes people most often think of Addison's disease, which is hypofunction of the adrenal cortex, or Cushing's syndrome, which is excess production of cortisol. And while both of these conditions are pretty well-established conditions in the medical community, what happens in between these two states of low and high cortisol has been questioned by the medical community for years. And this is where adrenal dysfunction has come to termed. And it's becoming more and more recognized as an endocrine disorder and helps differentiate between the different stages of dysfunction that occur between Addison's and Cushing's. So one of the ways I like to look at our adrenals is comparable to a bank account. And the adrenals have a certain threshold of stress that they can handle. And while that threshold varies from person to person, if careful repletion does not occur, a debt or an accumulation of damage can occur, resulting in adrenal dysfunction. And this could be because of just unrelenting exposure to stress or the cumulative effect of stressors like your diet, your lifestyle, lack of sleep, toxin exposure, whether environmental or food, trauma, perceived stress, physical stress, and so on. So when this occurs, the body can no longer properly adapt to or manage stress. Whereas under normal circumstances, when an acute episode of stress occurs, the body will increase certain hormones and respond appropriately, but then everything returns to baseline after normal. But of course, when this happens over and over and over, or it's just unrelenting, that's where adrenal dysfunction can occur. And so the first stage is basically the arousal stage, where both cortisol and DHEA increase with stress, and symptoms may or may not be present, but the hormones return to baseline. And then stage 2 is what we call the adaptation stage. And this is where cortisol is chronically elevated, DHEA lowers, and then the patients become more and more symptomatic. And you may see things like anxiety, depression, and mood swings. And since DHEA levels begin to deplete here, there may or may not be symptoms of sex hormone imbalances in this stage. And then stage 3 is the final stage. And this is the exhaustion stage, where adrenal insufficiency results in both low cortisol and DHEA, with oftentimes we'll see depression and severe fatigue. Now, low adrenal hormones can contribute to a lot of other conditions. So we'll often see poor digestion, hypothyroidism, infertility, things like that. But it's also important to rule out other differentials, as these symptoms can often be confused for other conditions. Now, there are certain ways that we can support the adrenals. And so, being that my background is nutrition, I'm always looking to food and herbs, supplements, and even lifestyle to see what we can do to manage this on our own without medication interventions, or maybe we want to implement these to improve the effectiveness of medications. So whichever that is, there are certain foods and herbs that can help modulate adrenal health. And so bitter melon, EGCG is a component of green tea. And then we have curcumin, holly basil, certain adaptogenic support agents, which you can see here, like rhodiola is a super popular one, licorice root, maca, ashwagandha. And then adrenal glandulars, I think there's limited clinical research on them, but they are coming out with more and more information. So that's a promising area to look at. Calming support, so things like GABA, L-taurine, 5-HTP is super popular, chamomile, things like that. And then we also want to look at nutrients like DHEA, and we're going to go into DHEA in a lot more detail to know when that's appropriate. But phosphatidylserine is helpful to lower cortisol. And then, of course, we always want to look at lifestyle. There's no sense in implementing a pill, whether it's a supplement or a medication, if we're not going to be trying to do the diet and the lifestyle to address the underlying root cause. And so a lot of times with stress, again, it could be inflammation or an infection. But if we're talking about somebody's environment, whether it's social stress, family stress, work stress, within means, we need to work with our patients to try to address that. We also want to address sleep dysregulation. So whether that's circadian rhythm training or light exposure for people with like a low soul awakening response. We also want to work on meditation or prayer, breath work, whatever is going to work best for that individual, and even vagus nerve stimulation through humming, gargling, singing loudly to just kind of downregulate things. So these are just a couple options. And then I wanted to dive into the role of DHEA. So we talked about that being produced in the adrenals. It is a steroid hormone and it comes from the adrenal cortex. And while the adrenals themselves are not a significant source of estrogen and testosterone, remember I said DHEA is a precursor. So to both estrogen and testosterone. And DHEA is converted to, I always say this wrong, so please feel free to laugh with me, androstenedione. And this can then be further converted into either testosterone or estrone, which is a type of estrogen. And it also helps balance the ratio. DHEA helps balance the ratio of estrogen and testosterone. Everything is a very balanced game when it comes to these hormones. But this adaptability allows DHEA to contribute to the hormone imbalance through basically individual needs and specific conversions. And then it also has an influence on secondary sexual characteristics. So things like libido. And for example, in postmenopausal women, when ovarian estrogen production decreases significantly, this is where DHEA production in the adrenal glands becomes a lot more important resource for things like estrogens. But it is worth noting that DHEA levels are naturally going to decline with age. Sometimes we see this in the late 20s or early 30s, which is a totally normal part of our aging process, but it can have implications for overall health if we start to have hormonal imbalances. So DHEA supplements are available over the counter in some places, and they're often marketed as like anti-aging or sexual health supplements, but they should be used with caution because if you over supplement, you could also have serious side effects from that as well. And then I wanted to give special attention to aromatization because this is a metabolic process that involves the conversion of androgens like testosterone into estrogens like estradiol. And this primarily occurs in areas of like adipose tissue, the liver and the brain, and it's mediated by an enzyme called aromatase, which you can see here on this photo. So when this process becomes disrupted, it can lead to hormone imbalances. So we may see increased testosterone if that aromatase conversion isn't happening to push it to more estrogen. But likewise, we could also see estrogen dominance when levels are pushed too far, aromatized. And that can lead to things like menstrual irregularities, mood swings, weight gain, and an increased risk of certain things like breast cancer. We may also see aromatization issues with women who have PCOS. Aromatization is believed to play a role in this very common hormonal disorder where there's an imbalance between androgens and estrogens. And then obesity is also thought to play a significant role because, again, adipose fat tissue is a site for aromatization. And then there's also certain medications that are known to treat aromatization. So a lot of times they'll block the action of aromatase and they're used in the treatment of like hormone sensitive breast cancers and things like endometriosis. So there are things that we can do to inhibit aromatization. So a lot of times we're looking at dietary fiber, flaxseed. I love flaxseed in particular because it tends to bring things that are too high down low and things that are too low up high. Obviously, soy, I think, is a pretty well-known modulator. And then grapeseed extract, white button mushrooms. There's that green tea again. Stinging nettle root and damiana. I've personally had a lot of experience with the stinging nettle root, not necessarily the other one. And I found it to be very effective. And then nutrients like quercetin, vitamin C. And then we're going to talk about testosterone. So stress can obviously impact our testosterone levels as well. And we often will have to differentiate between an acute stress and a chronic stress. So a lot of times the body will experience a temporary increase in testosterone levels. And this is just a natural part of our fight or flight response, where the body's going to like mobilize energy and resources to deal with that perceived threat or challenge. And then once it's over, levels turn back to normal. But the benefit to that in the short term is that it can enhance cognitive and physical performance. But in the long term, with chronic stress, we start to see other issues. So again, with that HPA axis, which is the hypothalamic pituitary adrenal axis, chronic stress can lead to a dysregulation of that. And so we may see increased cortisol, which is our stress hormone, or high or low DHEA. but high cortisol levels can suppress the hypothalamic pituitary gonadal axis, which plays a role in regulating our sex hormones. And then we have psychological stress and versus physical stress, which can all impact us differently. The psychological impact may be different than like physical stressors like overtraining in athletes. And of course, there's individual variability and then lifestyle factors like sleep quality, nutrition and exercise, poor sleep or diet, lack of physical activity. These are all going to exacerbate symptoms of low or high testosterone. So testosterone is, typically considered a male hormone, but it does still have a role in balancing female hormones. While we typically have significantly less testosterone than males, it's still essential for different parts of our health and well-being, including sexual health. So it does play a role in libido and like sexual desire in both men and women. And so we need to make sure that we have adequate levels of testosterone to support that. And then bone health. So testosterone does have an impact on bone density, and it may help reduce the risk of osteoporosis and fractures in women who are postmenopause. And then it also plays a role in muscle development and maintenance. So even females need to build necessary muscle and maintain lean muscle mass to support metabolism, overall strength, and health. And then testosterone also plays a role in our mood, our energy levels, and just overall well-being. So we also see improvements in cognitive health or cognitive function. And then it also plays a role during puberty in things like the development of pubic and axillary hair in women, and then also in ovulation. Although it's in much smaller quantities, there is some produced by the ovaries and the adrenal glands, and it plays a role in ovarian function. And then PCOS is also, again, that common hormonal disorder, and we'll see high levels of testosterone and things like irregular periods and acne, hair growth, and ovarian cysts. So in talking about testosterone, I also wanted to highlight how it's broken down and how it can either favor the 5-alpha reductase or 5-beta reductase. And these are enzymes that perform basically distinct functions in the metabolism of steroid hormones. And 5A reductase is more well known and clinically relevant due to its involvement in the conversion of testosterone to DHT, which is a very potent androgen. On the other hand, 5B reductase is involved in the inactivation of cortisol and has a much broader role in the metabolism of various steroid hormones. So you can see here in this pathway, if you are recognizing these images that I'm using, they're from a very popular hormone company. And I didn't pick it for any other reason other than I just think it's a great visual to show you the breakdown from DHEA into testosterone and then the different pathways that it can favor. So 5A tends to be more androgenic and symptomatic, and 5B would be the preferred pathway. I also wanted to highlight some symptoms because, we have all these different symptoms that are associated with low testosterone. So things like belly fat, bone loss, low energy, low sex drive. But then I went through and I wanted to highlight and just kind of reinforce that role of the adrenals. So understanding that cortisol and DHEA are a part of our adrenal output and the downstream effect on low testosterone. So I just kind of highlighted those symptoms that are the most associated so you guys could pick up on that. And then same with the high testosterone symptoms. So again, stress plays a role in high testosterone as well. Now, when it comes to ways that we can modulate our testosterone hormones, we're thinking about ways that we can inhibit that 5A reductase, which is going to favor more androgenic and more of the androgenic symptoms. And so they do make medications for this. So, especially in like men who have like benign prostatic hyperplasia or BPH, they're giving them medication to reduce the levels of DHT, testosterone. And then we see metformin in women with PCOS, even antifungal medications. And then we have specific medications that are called aromatase inhibitors. But there's also things that we can do with food. So again, there's that flax. We have grapeseed extract, white button mushrooms, red wine. Saw palmetto and nettle root are two of my favorite herbs to use for men and women with high testosterone. Reishi is just a really good adaptogenic herb for things that are too high or androgens as well. And then that EGCG is a component of that green tea. And then there's just different nutrients, flavonoids, which are super common in fruits and vegetables, and then polyunsaturated fatty acids. And I do want to go back and say that, these are all things to inhibit 5A reductase, because we don't really talk about inhibiting the 5B reductase just because that's not a common target for therapeutic purposes. Instead, the primary focus is often how to reduce 5A reductase because, the side effects of high testosterone. 5B reductase may be affected by some of these options here, but often to a lesser degree. And 5B reductase may be increased in instances of like insulin resistance or high triglycerides and things like that. So by focusing on those, you would normalize those levels. But you could also look at something like licorice. And then progesterone. Okay, so high levels of cortisol, which is produced in the adrenals as a result of chronic or severe stress, can often inhibit the HPA axis and the hypothalamic pituitary ovarian axis. So this is going to play a role in regulating our menstrual cycle and, of course, sex hormones like progesterone. So cortisol suppresses the release of gonadotropin releasing hormone, so GnRH, from the hypothalamus, and that will subsequently inhibit the release of LH and FSH from the pituitary gland. And these hormones are essential for the production of both progesterone and estrogen. So in some cases, there's a lack of ovulation. And so without ovulation, the corpus luteum, which normally produces progesterone during the second half of a menstrual cycle, does not happen. And so we'll see lower levels of progesterone levels. And the whole purpose of progesterone increasing is to prepare the endometrium of the uterus for implantation. So in addition, it may also play a role in balancing the effects of estrogen. And it's also considered, progesterone is considered a neurosteroid, and it acts as a diuretic, and it is responsible for increasing our body temperature. So when we're looking at progesterone metabolites, again, here's the pretty picture that I like so much from this company. But I like it because it breaks down and it shows you how it can either favor 5A or 5B pregnandiol. You guys, these words are so hard, so feel free to laugh at me or with me when I'm pronouncing these. But 5B has less activity in the body, but it doesn't represent the larger percentage of total progesterone or overall metabolism. So 5A is often a metabolite of more interest, but only because it can cross the blood-brain barrier and upregulate things like GABA, which again makes it very neuroprotective in the brain. And in some women, the 5A pathway is also considered to be a cause of PMDD or irritability due to issues with that GABA receptor's inability to adjust to like the sensitivity of fluctuating neurosteroids. So I thought that was pretty interesting. But if progesterone levels are on like the low or lower end, as you can see here, of the luteal reference range compared to estrogen levels, and women may experience symptoms such as PMS, menorrhagia, moodiness, anxiety, or even insomnia. So conditions like these not only impact sex hormones like progesterone, but also our stress and our adrenal health overall. So here are those symptoms again. So we see anxiety, infertility, insomnia, irritability, menorrhagia, PMS or PMDD. And I just kind of highlighted, you can see high DHEA, high testosterone, DHEA, and stress impacting multiple conditions here. So there are things that we can do to modulate progesterone. So certain foods like our lentils and salmon, pumpkin seeds, and then herbs like chaste tree is a big favorite of mine, and some phytoestrogens. I see black cohosh used in quite a few, fennel, anise seed, and then B6, vitamin E, and carotenoids. And you're going to see a lot of these repeated when we talk about estrogen as well, because again, it's like this delicate dance, this delicate balance between all of these hormones. So chronic stress can, as I previously mentioned, when we're talking about progesterone, the imbalance between the two, estrogen and progesterone. And so sometimes we'll see something called like estrogen dominance, where basically the ratio of estrogen to progesterone is skewed in favor of estrogen. And so this imbalance can lead to mood swings, irregular periods, of course, PMS. And a lot of times in acute stress versus chronic stress, so in short term or acute stress, the fluctuation in estrogen is often due to the effects of like cortisol DHEA output, and it'll temporarily suppress the secretion of that GnRH, that gonadotropin releasing hormone from the hypothalamus, which again can affect our LH and our FSH in the pituitary, which leads to a decrease in estrogen production. Now, in chronic stress or prolonged stress, some studies have suggested that it may lead to higher estrogen levels in certain individuals. And so this may be because of the increase in adipose fat tissue, which can accumulate due to chronic stress or unhealthy eating habits. And that in itself will produce excess estrogen. And then also chronic stress can disrupt our normal menstrual cycle, causing irregular or missed periods. And then I chose this picture again because I like how it shows the metabolism of estrogens, because stress can influence how we metabolize estrogen. Specifically, stress can impact the balance between the two primary forms of estrogen, which are estradiol E2 and estrone E1. And an imbalance in these estrogens can have implications for health, including things like breast cancer. So estrogen is metabolized primarily by the liver down 3 phase 1 pathways. We have the 2-OH pathway, which is considered to be the safest because of the anti-cancer properties of 2-OH metabolites, whereas 4-OH metabolism right here in the middle is considered to be the most genotoxic, as its metabolites can create reactive products that damage DNA that you can see down here in the bottom right corner. So the third pathway, 16-OH, creates the most estrogenic or symptomatic of the metabolites, but it's still considerably less estrogenic than estradiol itself. So overall, if estrogen levels are high, production of 16-OH E1 may exacerbate high estrogen symptoms. So similarly, a woman with very low levels of estrogen may have less low estrogen symptoms if 16-OH metabolism is preferred. So for example, there's one study that showed that a higher 2-OH to 16-OH ratio correlated with bone loss, which is a low estrogen symptom. And then estriol is thought to be safer or weaker, but it's important to remember that estriol is actually 16-OH O2. So generally, patients that make a lot of the potentially protective weak estriol may also make a lot of the estrogenic 16-OH. So when we're assessing all of this, basically optimal levels may depend on many factors, including the corresponding progesterone levels and of course the patient's history and symptoms. But generally, metabolism that heavily favors the 4-OH is considered a potential risk factor for estrogen-related cancers. And then poor phase 1 metabolism generally refers to the pattern that favors 4-OH or 16-OH estrogens, which are these two, over the 2-OH on the bottom left. And then poor methylation refers to patients who are not readily converting these estrogens down here into their further broken form of 2-methoxyl E1. And these are just basically methylated estrogens. So here's some symptoms of low estrogen. And again, we're going to see that stress and cortisol, low DHEA, and low androgens are going to play a role in multiple symptoms here. And same with high estrogen symptoms. We actually see elevated 5-A reductase and DHT testosterone here, stress, cortisol, things like that. Now, there are ways that we can modulate E2 in particular. So we can consume things like grapefruit, wild yam, and there's that flaxseed again. Of course, soy, I think, is pretty well known. Herbs that modulate E2, again, we're going to see a repeat here, similar to the progesterone. We have chaste tree. Oops, I put it in there twice. Peppermint oil and phytoestrogens, rosemary, and then a couple nutrients like B6, E, and carotenoids. There's that fiber, calcium D-glucarate, resveratrol, and fish oil. Now, when it comes to the metabolism of these estrogens, we want to make sure we're getting in enough for things for both phase 1 and phase 2 so we can really complete that detox. So things like cruciferous vegetables, carrots, peppermint oil, there's that rosemary again. And then for phase 1, we need sulforaphane and glutathione, and DIM is actually not advised because it can lower E2. And then if they have poor phase 2, the biggest thing that we can do is support methylation, but we also want to look at genetic testing, which we're going to dive into next. But to support methylation, here's some ingredients that we can look at, like SAMe, magnesium, B6, B12, folate, and betaine as cofactors. So of course, I could not give a presentation for MaxGen without talking about genetics. And these are the genetics SNPs that I know about, or that are the most well-studied, I think. So the first one is COMT, which is catecholomethyltransferase, COMT. It's a gene that creates an enzyme that breaks down dopamine, norepinephrine, epinephrine, and estrogen. And these chemicals play a role in like our mood, stress response, and productivity. So estrogen needs to be balanced and reduced appropriately, like we just talked about. COMT does require the methylation cycle. So we want to keep in mind of our methylation items that we just saw on the last page. So things like SAMe, magnesium, and folate, B12, because we want to make sure that we have those in adequate amounts to support that methylation. And then it's been observed that individuals with slower COMT tend to be sensitive to methyl donors. So in these cases, we would want to use non-methylated vitamins like folinic acid, or hydroxycobalamin might be better here. And then so COMT is an enzyme that plays a role in the metabolism of catecholamines. We talked about that. So, and when it comes to estrogen, COMT is responsible for converting estrogens into the less and more easily excretable forms, such as the 2-methoxyestradiol and 4-methoxyestradiol, like we previously talked about. And then any disruption in this can obviously have implications for estrogen-related health issues in the future, like breast cancer. And then MTHFR is another enzyme involved in the metabolism of folate, or B9, which is crucial in the body's methylation process. So I keep saying methylation, and I haven't really talked about what it is. So methylation is a biochemical reaction that involves the addition of a methyl group to various molecules, including DNA, proteins, and neurotransmitters. So the methylation reactions are essential, and they're just a part of the physiological process. And when we have a deficiency in certain vitamins or cofactors, then that process isn't going to happen. But MTHFR also refers to the gene that encodes this enzyme. So the gene provides instructions for making the MTHFR enzyme, and any variations or mutations in this gene can affect how the enzyme functions. So these gene variations can have implications for, any individual to metabolize folate and homocysteine if they have those variants. Particularly, there's 2 very common variations. So one's called the C677T, and then the other one is A1298C. And these can result in lower MTHFR enzyme activity, which would basically mean that the body can't efficiently metabolize things like folate. And so, we may see hormone regulation through methylation and estrogen metabolism decrease that way. And then there's CYP1B1. So this is also known as cytochrome P450. This is actually a superfamily. Cytochrome P450 is the superfamily, and then 1B1 is the actual enzyme that we're going to talk about. But this family of enzymes plays a crucial role in the metabolism of various compounds, including drugs, environmental toxins, and endogenous molecules like our hormones. So CYP1B1 in particular is involved in the metabolism of multiple things, including certain estrogens. And the primary form of estrogen that it metabolizes is called 17-beta estradiol. And the enzyme basically converts estrogen into various different metabolites, including 4-hydroxyestradiol, which we talked about. So obviously a disruption in this is going to have an impact on the balance of our hormones, in particular estrogen. So we want to be on the lookout for those different mutations. And then I just put like nutrient genetics that could be influence any part of this. The MaxGen test looks at so many different variations and different vitamins. And we know that these vitamins play a major role in all kinds of different processes, and that they're cofactors for not just methylation, but all kinds of other physiological functions. And then if we have a variation in any one of these genes related to these vitamins, we want to make sure that we're addressing that so that we can stop that downstream effect. But basically, I wanted to conclude and just kind of reinstate the fact that it's important to look upstream and downstream of any hormonal imbalance that you find or suspect, and consider the interconnectedness of all of the body systems and how they work together. So somebody with poor gastrointestinal health may not make the appropriate enzymes like beta glucuronidase, for example, which is needed to break down estrogens. And so in that case, if I saw that on a stool test, for example, I would want to make sure that I address their gut health in conjunction with, or first sometimes before addressing any hormonal imbalances. And then in this particular case of today's subject, if somebody with known stressors or adrenal dysfunction, again, if we're looking upstream from hormonal imbalances and we're kind of putting together that the adrenals are playing a role, we want to make sure that we're addressing that as well, if not first, to make sure that we can cover everything that's happening after that. As a clinical nutritionist, I try very hard not to overwhelm my patients with an expansive list of like lifestyle, dietary, and supplement changes all at once, because it's already daunting enough trying to take in all this information and the things that they have to change. So we want to make sure we're doing it in a step-by-step way. And if I can kill two birds with one stone, so to speak, by addressing the adrenal health and understanding the downstream effects it's going to have on balancing their testosterone and their estrogens, progesterones, and things like that, I don't have to give them a whole bunch of recommendations for the hormones, right? If I can just focus on addressing the adrenal health, or if I can do a genetic test and understand that there are variations that are going to make them a poor methylator, I'm just going to go ahead and give them that so that I'm not having to give them, 5 or 10 different things to address everything, if that makes sense. But sometimes that means that we have to start with managing things like poor sleep habits, managing our stress, and just lifestyle techniques like deep breathing and yoga before we go down that pathway. We often start with lifestyle changes and then we layer in the diet. And that in itself can be a process of just doing like one thing at a time. Maybe we start by removing inflammatory Western diet and food and things like that. And then we slowly add in cruciferous vegetables, wild yams, some flax in our smoothie in the morning. You know what I mean? And then we have to add in the supplements. And this is just for somebody who doesn't need referred out, because a lot of times there's that collaborative care too, where as a nutritionist, I'm working with that person's primary care doctor at the least, if not a bunch of specialists. Maybe they have an endocrinologist. So many of the people I see have diabetes. And so a lot of times it's just, that collaborative effort that's just going to make it that much more streamlined for the patient and effective ultimately. So that's about all I had. This is how you can reach me afterwards. I appreciate you guys for listening to me. I'm happy to answer any questions you may have, but feel free to take down this information and let me know if you have any questions.
That was great, Tara. Definitely give Tara a follow. Her Instagram handles are there. She posts some really good content. We've been following her. We've been working with you for about a year now, right? Is it a year? Yeah, about a year. And give her a follow. Thanks for joining. I know some of these hormones can be kind of complicated, so we're going to definitely repost this webinar here in the next couple of days. So stay tuned. Follow the Facebook page and we'll post it there. Thank you, Tara. Good job.
Thank you. Thanks for having me.
No, we'll do it again soon for sure.